I still can't believe COVID affected my family the way it affected my family. So my dad and my stepmom I call her she's not my stepmom, she's my mom. I was just blessed with a bonus mom. Because they've been married since I was 1. So 2019, we all went to Wisconsin that summer. They didn't come here, we went to Wisconsin. That's all of us. August 12th, my dad called me and told me that she had gotten COVID. She went to the hospital. She ended up in the COVID unit. My dad finally got his test back right after she got admitted, and he was positive for COVID-19. He got admitted 2 days later, so they were both in the hospital. August 19th, I got a text while I was at work that said, "I'm sorry, I love you guys, but I'm not gonna make it." She was tired. She'd been working to breathe for 2 weeks and wasn't getting any better. And every emotion I think you could feel, anger, watching somebody pretty much suffocate to death. It was sad, and they were not vaccinated. It's different when it happens in your own family. Hey Richard, you want to get your shot today?
Shot for what?
COVID?
Hadn't thought about it really.
Why not?
You think I really need it?
I do. You got a lot of lung problems. Is there a reason why you have it?
There's a lot of people getting sick from it, and
well, I mean, the risk of a side effect from it is a lot lower than a risk of getting COVID and ending up in the hospital with you, because you have asthma.
Yeah, I've been there. Yeah,
you can think.
Yes, I better go ahead and do it then.
You want to go ahead and do it?
Yeah.
All right. I ask every patient that comes into the clinic if they're COVID-19 vaccinated.
Which arm do you want? Your left or your right?
Probably right, because I usually more.
I put worse things in my body than a COVID vaccine.
All right, just relax.
I personally and medically still believe that the risk is minimal for a side effect from a COVID-19 vaccine.
All righty. All right, got everything?
Yeah.
I work for Boston Mountain Rural Health Center in Green Forest as a nurse practitioner for them. I'm the sole provider in that clinic. We provide care to people who are uninsured, underinsured, pretty much everybody in all age ranges from birth to death. We're there to care for people.
I was a nurse for only about a year before the pandemic started, and I worked in the hospital at the time, and it was just a completely different world. Hey, are you here for a COVID test? Yes. So you just tilt your head back for me. It's gonna go in each nostril for 15 seconds. We also became short-staffed because nurses were quitting to go take travel assignments in areas that were being hit really bad and needed extra nursing. So we became very short-staffed when we were taking care of some of the most critical patients that we've ever seen on the floors, not in the ICU. It's definitely been high stress for a majority of my career.
I'm about to get my COVID-19 shot. I've had COVID twice. The last time was a couple of weeks ago. Worse than the first time I had it. It was absolutely horrible. I was having problems breathing. Didn't have to be hospitalized, but it was definitely a lot worse the second time. I'm just here basically today. I'm a school teacher, and so I just feel like it's my civil duty to get vaccinated.
Have you filled this out real quick?
Well, looking at all the social media out there and seeing what other people go through getting the vaccine, it's scary. It's not something that I just come to the conclusion of that, oh, hey, you know what, I'm gonna go get vaccinated tomorrow because media's telling me to. I've been through COVID not once but twice, and second time was a lot worse, and it scared me. It scared me not for just my kids, but my school kids as well. And it's, for me, it's just personal. It's just best to get it versus not getting it, basically.
Okay, I can feel a stick. And that's all there is to it.
So we are in Lead Hill, Arkansas, on our property that this used to be an old farmhouse. This is the kitchen and the living room. And then in here, walk around all this paint. It's gonna be home eventually. We decided to sell our large farm that we had. There's only 3 of us, so. Huh?
I wouldn't have took the shot if it wasn't for Maddie. She's got asthma real bad, and that's the only reason I really took it. I probably wouldn't have in any other circumstance. Just kindly protect her.
Because I had talked to him about getting it, and it was no, 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 no. And then finally he came around when, kids were starting, Arkansas Children's had sent out an email to medical providers about how they were seeing more inpatients with kids. And that was the big impact that I think made him make his decision to get vaccinated for her.
I come down with the virus. And then after I got over it, my mother came down with it, and she passed away with it. She passed away on August 15th, and I just knew that was when I needed to get it. Let's do it on the right.
Okay.
Since I'm sitting this way.
We can do that. I'm just gonna roll that up there and just relax.
I feel like it's my duty as a healthcare provider, knowing and seeing what can happen not only on a medical level, but also on a personal level. I don't think COVID picks who it wants to attack. It doesn't matter if, what color your skin is. It doesn't matter, what comorbidities you have. It doesn't matter if you have blonde hair or black hair, blue eyes or green eyes. I mean, you have the potential to get COVID, but we don't know who's gonna get super sick and who's not, and that's the scary part about it.
To find a COVID-19 vaccine location near you, visit myarkansaspbs.org/vaccine or call 1-800-985-6030.
Para encontrar una vacuna contra el COVID-19 cerca de usted, visite myarkansaspbs.org/vacuna o llame 1-800-985-6030.